right, we are very excited to be here today with Dr. Robert Ostfeld. Now, Dr. Ostfeld is the Director of Preventative Cardiology at the Montefiore Health System, and he's Associate Professor of Clinical Medicine at the Albert Einstein College of Medicine in Bronx, New York. He has a medical degree from Yale and a master's in epidemiology from Harvard. Dr. Ostfeld did his internship and residency at the prestigious Massachusetts General Hospital and his cardiology fellowship and research fellowship in preventive medicine at Brigham and Women's Hospital. Thank you so much for being here today with us, Dr. Ostfeld.
Oh, well, thank you both so much. It's an absolute honor to be here with you, and I love what you guys are doing, touching so many lives and helping so many people.
Well, we feel the same way about you, and we're going to learn all about, exactly how you promote positive lifestyle change at Montefiore and beyond. So let's start here today by talking about the specific experience that you have working with people with diabetes. Can you go into a little bit of detail about what you see in your hospital?
Yeah, absolutely. Unfortunately, diabetes is extremely common. So I see it very commonly, patients with diabetes on multiple oral medications, on insulin. So it's something we encounter a lot. And of course, at least I'm primarily talking about adult onset diabetes, as I'm an adult cardiologist. So I primarily see that. And of course, the risk factors for developing diabetes are pretty much the same as developing high blood pressure and high cholesterol and coronary artery disease. So unfortunately, there's a lot of not pleasant company that diabetes keeps. So when I see someone with diabetes, they typically they're usually obese. They have high blood pressure, high cholesterol, coronary artery disease. And if you guys came to one of our patient conferences, our teaching conferences with the fellows or residents, it's as if there's like a template. There's an X-year-old person presents with chest pain, and they have diabetes, heart disease, high blood pressure, high cholesterol. It's like you just put a stamp. So it's unfortunately obscenely common. And in the context of that, have seen just the most obscene turnarounds. And patients being able to come off multiple medications, their oral ones, their insulin, reversing their diabetes, and improving tons of other aspects of their health. So, people often say, well, there's a diet for cancer, and there's a diet for heart disease, and there's a diet for disease X, Y, or Z. I don't really look at it that way, and I know you guys don't either. There's really, on average, there's really one diet that promotes health in multiple milieus. And unfortunately, when you have diabetes, your risk of developing heart disease goes way up. When you have diabetes and high blood pressure, it's like a 1-2 punch. Increasing the risk of heart disease, increasing the risk of stroke, among other things.
So, what is the relationship between coronary artery disease and diabetes?
Unfortunately, the relationship between coronary artery disease and diabetes is extremely tight. And there have been some studies that suggest that people with coronary artery disease and no diabetes have about the same future risk of developing a heart attack as people with diabetes and without coronary artery disease. Now that relationship may not be quite as strong, but it's still there's far too much coronary disease associated with diabetes. So why might diabetes promote coronary artery disease? The first thing is a lot of the risk factors that go into developing diabetes, obesity, sedentary lifestyle, go into promoting heart disease. Also, of course, the dietary aspects too. The more animal foods that you eat is, strongly associated with more heart disease, also more diabetes, given the lipotoxicity that it can cause in muscle cells, causing insulin resistance. And the metabolic milieu that develops after eating more animal products, being more obese, having a sedentary lifestyle, promotes diabetes, of course, but it also promotes heart disease for a variety of reasons. It can promote inflammation. When you're eating the animal products, you can have more oxidative stress from the iron in the animal products that promotes both diabetes and heart disease. That metabolic milieu, that the insulin-resistant metabolic milieu, is deleterious to cholesterol particles, making them more pro-atherosclerotic or pro-heart disease than they may be without that. it causes damage to endothelial cells, the diabetes itself, as well as the company that it keeps. And when you damage the endothelial cells, or the inner lining of our blood vessels, that lets cholesterol particles burrow across them into the wall of the blood vessel, where then they can become oxidized and act kind of like a splinter. So it's like you have a splinter in the wall of your blood vessel, causing more and more inflammation, more and more damage, exactly where you don't want a splinter. So the relationship is tight. They share a lot of common risk factors, which bring them along together. And the metabolic milieu that promotes insulin resistance and ultimately diabetes also brings on coronary artery disease through a variety of mechanisms, pro-inflammation, pro-oxidative stress, damaging making cholesterol particles less healthy and damaging endothelial cells, as just a few pieces of a larger puzzle of why they go together in an unfortunate way.
Got it. And what is the relationship between high blood pressure and diabetes?
Well, the relationship between high blood pressure and diabetes is similar. Many of the risk factors for diabetes are also risk factors for high blood pressure. And that, again, it's like a right hook and an uppercut. The two together make you more likely to get heart disease, more likely to have a stroke. These are more likely to have kidney disease, kidney damage. These are things you do not want. And along the lines of what we were talking about earlier, and this is a problem, I think, with medicine, we're much too siloized. You know, there's the hematology oncology team, and there's a cardiology team, and there's a kidney team, and then there's the joint or rheumatology team. And everybody works really, really hard to help patients get better, but we all have our own different literature and our own different conferences and things don't meld as much as they should. And I think that's one of the reasons why it's been harder to get the word out among medical professionals about the non-silo benefits of a plant-based diet, because it's good for the joint docs, and of course good for the heart docs, and good for the diabetes docs and the kidney docs, and on it goes.
Okay, so Dr. Ostfeld, can you give us a little insight here into when you see a patient living with cardiovascular disease, whether it's high cholesterol, coronary artery disease, high blood pressure, or any combination thereof, what are your specific dietary recommendations that you try and educate them about so that they can actually start to reverse a lot of these disease processes?
So the ultimate goal, ideally for me, would get them to have a whole food, plant-based diet without oil. That's my ultimate goal, but I don't want perfection to be the enemy of good. If one of my patients says I can do it 70% of the way there or 60% of the way there, and that's all they're going to do, I'll take it. It's better than 10%. So my ultimate goal is whole food, plant-based, no oil, because it has non-siloized benefit across multiple health issues, including diabetes and heart disease, the primary topics of today. So patients come to see me basically from one of two buckets. The first bucket is they've somehow heard about our wellness program here at Montefiore, and they seek us out. And those people tend to be primed at the pump a little bit. They're ready to embrace much, much more of a plant-based diet. That's bucket number one. Bucket number two is people who are plugged into the Montefiore system. It's a very, very large system. I think it might have 11 hospitals or rehab hospitals, probably employs 30 to 40,000 people. And they just need to see a cardiologist for whatever reason. They have chest pain, palpitations or something. They just wind up in my office because they're plugged into our system. So those are the two buckets. But bucket number two, oftentimes when I mention a plant-based diet to bucket number two, they'll look at me like I'm from Mars. Like they've never heard about this. So it's a bit of a steeper climb to get them from what is usually a typical Western diet to whole food, plant-based, no oil. But that's my goal with them as well. So I sit in the office with every patient. I do this for inpatients as well when I'm rounding in the hospital. I will say, I discuss why I think how they're currently eating is not helping them and promoting the disease process they have, and that we desperately need to protect them. And the current path that they're on is leading toward another heart attack or another stroke or a stroke. but that we can turn things around and make them much healthier. And then I walk through. I ask them, I want them to eat plants and not animals. I have handouts that describe this in more detail, but I'll ask them, look, I want you to have 3 servings of green leafy vegetables each day, 3 servings of fruit each day, preferably some berries, 3 servings of vegetables, other vegetables each day, lots and lots of herbs and spices, and on this discussion goes. There's a couple caveats that I should make. If someone is on insulin and we switch their diet, we have to be very careful because we may make them so healthy so quickly that their insulin requirement may plummet. And we have to talk in detail about the symptoms of low blood sugar, how you treat that, and how we can, decrease the dose as needed of the insulin. The 2 other important caveats are, if someone's on Coumadin, which is a blood thinner, oftentimes for a mechanical heart valve or atrial fibrillation, Coumadin blocks vitamin K. And when you eat more green leafy vegetables, you get more vitamin K. So if you all of a sudden are on Coumadin and eat way more green leafy vegetables, your Coumadin level may fall, putting you at risk from atrial fibrillation of the mechanical heart valve. Now, you can 100% absolutely definitely eat green leafy vegetables and take Coumadin, and I want my patients to have the benefits of both, not just either or, but you have to do it very carefully with your Coumadin team. The Coumadin team needs to know that you're going to be adjusting how you're eating, and they have to follow your Coumadin level very closely initially until you get to a new steady state. And if you get there, typically if you eat about the same amount of greens each day, you will keep things steady. So and the third caveat is, now unfortunately kidney disease goes along with diabetes. And if someone has advanced kidney disease, their potassium levels may be high. And eating a plant-based diet is exquisitely healthy, exquisitely nutrient dense, but it tends to be higher in potassium. So if someone has pretty advanced renal issues, we have to follow their potassium closely, and we may steer them away from some of the higher potassium foods like potatoes, tomatoes, oranges, things like that. But those are by far the exception and not the rule. The rule is that you're going to embrace eating this way and do way better. So I talk with them in detail about why that would be. I try to find a hook, like, is their kid's graduation coming up? Do they want to look good for a reunion or whatever it might be, where they want to be as healthy as possible. So we try to weave that into the discussion. And so then I give them handouts with sort of a detailed plan about how I want them to eat. And we'll have them come back in 4 or 6 weeks for weight checks or blood pressure checks, things that we can just use as easy objective markers so that they can be accountable to something. I find those touch points with patients help a lot. Mm-hmm. And on top of that, we have these periodic Saturday morning sessions that are about 4 hours long, where I modeled it after Dr. Esselstyn's sessions in Cleveland. And I'll speak, a nutritionist will speak. We serve a plant-based lunch. We don't charge patients for it at all. I fund it all through donations. And that's a great time for us to be able to spend more time speaking with patients, and we have them bring in a friend or significant other who can help them along the path. And we don't have that kind of time, obviously, in clinic to be speaking to patients about the stuff in that kind of detail. So that is, in a real nutshell, the outpatient program. So I talk to them about it in detail, about how I need them to eat, how it'll be healthier for them, try to find a hook, give them the handout. Hopefully they'll come back every 4 or 6 weeks for these accountability checks. And we have the periodic Saturday morning sessions, which are like a nice punch in the arm to help move people further along in this way. And, many patients embrace it. Some patients don't. Some patients give me the Heisman for even a couple of years. And then they come back 20 pounds later. And I'm like, what happened? And I'm like, well, I just decided to do it. So it's pretty cool. So that's the outpatient program in a nutshell and what we'll do.
This is great. And we know that your hard work has resulted in forks over knives being shown in every hospital room at Montefiore Medical Center. So can you tell us how that's impacted your patients?
It's been amazing. It's absolutely amazing. I round in the hospital 8 weeks a year. And so a number of years ago, I'd tell people about plants, I'd leave, and 30 minutes later, dinner's served, and it's chicken. I'm like totally undercut. So I'm like, this is no good. So we developed plant-based meals for inpatients that you can now order in, I believe, 5 of the hospitals in the Montefiore system, like about 2,000 beds. But that wasn't enough, of course. We needed an educational component, and Forks Over Knives is amazing. So we were very fortunate that we work closely with the Forks Over Knives team, and they're an incredible, incredible resource. And so we got the films to play on the TVs for patients. The patients are not charged for it. It plays on continuous loop, and we have the Spanish subtitles, which is important for us because we have a very large Hispanic population here in the Bronx. So that's been incredible. And I'll walk down the hallway because I feel like I know the movie like the back of my hand now. Like I'll walk down the hallway and I just hear it percolating out of patients' rooms. We've had patients come up to the nursing station and say, I want to, before they've even been like fully assessed by the medical team, like I want to eat like that. So it's been pretty cool. And of course, patients can watch CBS News if they want to, or NBC or whatever, but Forks Over Knives is also an option. So we're really, really proud about that.
This is great. So a patient is in the hospital. They're under your supervision. They have the opportunity to watch Forks Over Knives on television. They're listening to you talk to them and give them ideas about how they could modify their diet. So you can kind of control that environment while they're there. But the second they leave the hospital, they go back home. Can you give us some insight here into what is the compliance rate? Do you have some idea as to, what proportion of all the people that you touch in the hospital follow through on a plant-based diet, and what types of successes or, like frustrations happen outside of the hospital?
I know that much better for our outpatient program, but for the inpatient program, I do not know that anywhere near as well, because there are literally thousands of doctors around here and they can go back to kind of anywhere. And so it's I don't have the infrastructure to follow that up. And so, but when I look at this is they'll be in the hospital maybe for a couple days or something. And I look at it as an incredible teaching opportunity and a great opportunity to plant a seed. And so my goal, it would be great if we could help everyone go plant-based, but I think for us, a more realistic goal is just to plant a whole bunch of seeds. Now, some of these patients will follow up within the Montefiore system or with doctors who are interested in plant-based diets. And I've gotten communications back about how people have really turned things around, but I don't have that information in a systematic way. And that's honestly because we're currently under-resourced. I don't have the staff, and I'm trying to raise funds to grow our staff and grow the kinds of things that we can offer. But right now, I don't have the infrastructure to be able to follow all the inpatients into the outpatient setting, because it's kind of like the diaspora. They can go all over, tons of different doctors. But our short-term goal is to plant the seed. And then our longer term goal is to help it grow for all of them as outpatients.
This is great. Okay, so let me ask you this now. Is it necessary for somebody living with diabetes, living with coronary artery disease, any version of cardiovascular disease, is it required for them to go 100% plant-based or 100% vegan? Or is it, is moving in the direction, but having small amounts of animal products, does that still get the job done?
Yeah, I do not think it is necessary to go 100%. Ideally, they would, I believe, but it's not an all or none thing. There are multiple studies that show the further you get along that path to becoming more and more and more plant-based, the better you do. There's a really interesting analysis by Dr. Du from China, where he looked at about 500,000 patients. And in this study, they looked at fresh fruit consumption and what impact that had on diabetes. So of that 500,000, there's about 470,000 who did not have diabetes to start. And then they follow them. The more fresh fruit you had per day, the less likely you were to develop diabetes. I'm kind of sick and tired of hearing that fruit causes diabetes. And just to emphasize, the more fruit they ate, the less likely they were to develop diabetes. Okay, that's very interesting stuff. But more germane here is 30,000 people in that study, in that cohort they had diabetes at the very beginning. And the more fruit that they ate, the better they did. The people with diabetes at the beginning of the study who ate more fruit did better long-term, less heart disease, less stroke, better diabetes outcomes. So this is an incredibly important thing. But along those lines, for me, the further along someone gets on a plant-based diet, the better they do. There's a very interesting study by Dr. Satija in the Journal of the American College of Cardiology. Now, it wasn't specifically about diabetes, but this one showed that the more toward a plant-based diet you ate, the better you did from a cardiovascular perspective. And then that's one of multiple other studies. The EPIC study, every standard deviation increase in fruit and vegetable consumption, the better people did. The Cardia study, when people were 25 years old, the highest tertile of fruit and vegetable consumption versus the lowest 20 years later was associated with significantly lower odds of coronary artery disease. And subgroup analyses of the PREDIMED study as well show the more toward a plant-based diet you eat, the better you do. So it does not have to be all or none. And anecdotally, my patients who tell me they go at least 50% plant-based, and this is just, they just tell me that's what they're doing. I have no way to track it at home. That's when I really start to see things change. But the ones who tell me that they're like, 98% or 100% whole food plant-based, no oil, are the ones who have the most obscene turnarounds you've ever seen. So something is good, more is better. And I had this cool conversation with some colleagues the other day. I'm like, hey, when's the last time you saw a patient, when their A1C went from like something ridiculous, a hemoglobin A1C, of course, a serum marker of chronic levels of blood glucose, from like 14, normal is about 6.5, 14 is really high. From 14 to normalize, come off 6, 7 meds, lose 30, 40 pounds, feel so much better, like never, they never see that. But we see it all the time. It's extremely common when people eat a plant-based diet. So some is good, more is better.
It's so great to hear you say all that, and we love seeing those results as well, and seeing our clients, our members eat fruit. Like, we're encouraging that, seeing amazing results, and it's great to see you talk about the science behind that. Now, what about foods like potatoes? People living with diabetes are very scared of those. Are they okay?
I think they are okay. It's truly a whole grain, even though they're white, but it's truly a whole grain. It's different than, like white flour and stuff. Now, they are somewhat higher in glycemic index. So, at the very beginning, when someone, of switching to a plant-based diet, if they eat high glycemic index foods like a potato, their sugar may shoot up initially. And that's because they've yet to heal the underlying reason for the diabetes. I'm talking about adult onset, the insulin resistance. So it may take a little while for the lipotoxicity, for the insulin resistance to heal. But so sometimes maybe we'll have people steer a little bit clear of high glycemic index foods for the first few weeks and then weave them back in just to let them heal a little bit. And I may be misremembering this a little bit, but Dr. Barnard had a very interesting randomized controlled study looking at about around 99 patients with type 2 diabetes, and they randomized them to a whole food plant-based diet versus an American Diabetes Association diet. And guess which one won? Not the American Diabetes Association diet, the plant-based one won. But in that plant-based diet, I believe they had lower glycemic index foods over the number of weeks of the study, exactly, I think, for that reason, that they wanted to give people a chance to have that insulin resistance, that muscle lipotoxicity heal.
It's terrific. Now, you're a very busy guy. We would love to hear, how do you adopt this lifestyle? How do you fit it into your schedule as a doctor? What do you eat in a typical day?
Oh, well, thanks. I mean, I feel like if I'm going to talk the talk, I got to walk the walk. And so My morning is almost always oatmeal, toss in some fruit. I toss in a ton of spices, just whatever I can randomly shake in. I figure like just buff up the antioxidants, why not? So that's typically breakfast, but I'll eat like a giant bowl of oatmeal, sometimes 2 bowls. And I'm not perfect at this, but what I try to do is have like a bowl of greens just sitting there in the morning. So while I'm making my tea, I will just grab a handful of whatever it is and squeeze on a little bit of vinegar and then just eat it. So I get in a serving of greens at breakfast. And for my really sick patients, I'll ask them to have 6 servings of green leafy vegetables throughout the day. And I learned that from Esselstyn. That's helped for our really advanced disease patients. So that's breakfast. Lunch is typically some kind of salad. Our hospital cafeteria here also serves the plant-based meals that we give to inpatients. They also serve it within the cafeteria for visitors and staff, and they tell me it sells out. So I'll go to the salad bar, get a big salad, and I'll toss on some of the vegan offerings that they have like on top. And sometimes I'll have a smoothie for lunch as well. Our cafeteria has a smoothie bar, which is pretty cool. So that's typical lunch. And dinner is kind of random. Sometimes I'll get a plant-based wrap, or I'll go out to eat somewhere. I live in Manhattan, so there's tons of opportunities, places to go that are truly plant-based. And if you call ahead, they'll make things, oftentimes with no oil for you. So that's great. And on occasion, for dinner, I'll find myself at a steakhouse, and whether someone does or does not want to support that kind of institution is another thing. But sometimes for meetings or whatever, I'll need to go to those. But that's an incredibly easy place to eat plant-based, because you get a baked potato, you get a ton of steam, you can get a side of steamed whatever, Brussels sprouts, spinach, and a big salad. And it's awesome because when I go to those places, first, I love how the waiters and waitresses just look at you like they've never heard these kinds of orders before. I went to one on like December 30th, and the waiter impromptu just said, this is the healthiest order I've had in the entire year. So 364 days. So that's pretty cool. I'll like make some whole grain pasta with a marinara sauce that does not have oil, and steam some vegetables and put that on top as well. So dinner is a little bit random, but breakfast and lunch are kind of more, routine. And look, I'm not a big chef. I'm not really into cooking. I want it to be efficient and quick and tasty. And that's sort of worked out, and I feel lucky.
That's great. Okay, so the final question we have for you is, in all the patients that you've worked with, inpatient, outpatient, all your experience, what is the number one challenge that you see people face when making lifestyle change, and how do you help them overcome that?
I think the number one hurdle is that the society is not geared for people to live this way. There's tons of unhealthy fast food options out there. And what I mean society geared, there's commercials not supporting healthy eating. People are raised in a way that's not healthy eating, and they get used to that. So it's breaking this pattern. Diseases run in families, but so does diet. And so it's breaking that societal influence pattern that people have. And so I think, and coming at that from a number of angles is important. And behavior change, to me, is the holy grail of medicine. Like, we all know that eating kale is good for us, but getting ourselves to do it is another story. So we come at it from a few angles. The one is the educational component, where I talk with patients about it and tell them advise them what I think they should do, and build some structure around that with our handouts that have, check 3 boxes check a box every serving of green leafy vegetables, check a box every serving of fruit. So they have real structure around that, and our accountability. They're going to come back in 6 weeks and have their weight checked, whether they've gained 80 pounds or lost 80 pounds, they're coming back. And so there'll be some accountability there. So that's part of it. Another part of it is particularly our Saturday morning sessions, where we can educate them more, but more family members, more friends can get involved. And that's incredibly helpful because, if you're married or have a significant other, having that person take this journey with you is really important. Because if that's separate, that's really hard. Like cooking 2 different dinners, it's just a lot of stress and time. So bringing that together is really helpful. And with that comes socializing and family reunions. So the more people in someone's circle that can at least be open to it, the better. So for me, the biggest hurdle is overcoming societal programming and societal hurdles to living this way. And with a combination of education and having that education seep into the person's sort of inner circle of people in their life is the best way I found to help people overcome that.
Yeah, I think you just hit it on the head, because there's, we like to think about it as though there's a lot of things that you have to unlearn in the process of learning why plant-based nutrition can be so powerful. And whether it's marketing messages, whether it's billboards, whether it's something that you read in the newspaper, whether it's a conversation you had with a friend, there's a whole bunch of these sort of like myths that float around about the necessity of having oil in your diet, or are eggs good for you? And if those messages are reinforced over and over and over again over the course of your life, I'm not talking just a couple of times, I'm talking over the course of 20 to 30 years, then you start to believe it, right? So just like you're saying, you're just kind of learning that there's actually a whole new truth that we don't know that much, that perhaps you don't know that much about, opening your mind to it and then getting away from these sort of societal norms. That's really kind of the gateway into getting into a whole new version of health, in where you don't necessarily have to be dependent on medication and the medical system as much.
Yeah, I totally 100% agree.
Yeah, it's your experience is just so invaluable, because you attack this from a cardiovascular perspective, because you're a cardiologist, but yet, like you're saying, you see diabetes and cardiovascular problems run hand in hand with each other. And I know that a large proportion of our audience suffers from both conditions, some version of diabetes with some version of cardiovascular disease. And so, I know your message is like so pivotal and so helpful for so many people. So if I haven't already said so before, thank you for doing what you do. Thank you for educating thousands of people. Thank you for touching people, in person, and for really, really taking your time to educate them, because it goes a long way, and I can see it and Robbie can see it. And we absolutely love what you do.
Well, thank you guys. I feel like it's wonderful what you guys are doing, and how kind of this message of health, and I don't mean message, as you guys know, in anything but a completely evidence-based way. And I should say, I have no vested interest. My vested interest is in my patients getting better. I don't have a book to sell. I don't have a product to sell. All I want is my patients to get better. And I've been a cardiologist now for about 15 years, and outside of a medical emergency, like someone gets shot and has to be put back together again, I've never seen anything come close to the breadth and depth of benefits that a plant-based diet provides. And you could even put aside my anecdotal experiences. They are backed up by reams and reams of peer-reviewed data, from basic science studies to epidemiology studies to randomized controlled studies. And one of a big hurdle, exactly what you guys are doing, is helping us connect people with that information. There's this like a huge chasm, and that chasm also separates the medical world from that information. And what you guys are doing is helping to bring them together. So that's incredible. So thank all of you, and thank you to the many great docs and teams out there who are doing exactly the same thing.